Usually when we see the patients, they're emotionally, they're understandably upset. It's challenging to kind of comprehend everything that's going on. So I think we recognize that. We don't want to overwhelm our patients, but we certainly want to educate them and their families about what their options are going to be. And we really start to talk about the different options and what factors will contribute to us deciding which type of reconstruction to do. And then based on that, we can come up with what our options are and maybe our top 1, 2, and 3 options that they should consider. And then I think together we can make a decision about how to proceed. There's been numerous studies that have looked at the psychological benefits to having breast reconstruction, either primarily at the time of mastectomy or secondarily down the road after you've had the mastectomy. And it's pretty universal that there's a clear psychological and emotional benefit to having reconstructive surgery, at least begun at the time of the mastectomy. So for example, if we have a patient who is going to have a mastectomy and say have a tissue expander or balloon placed at that time, well, they're not going to have a fully shaped breast when they wake up from their mastectomy, but at least I think in their mind they know that there's a commitment towards getting them to a point where they can feel very comfortable getting out and doing the things that they like to do on a daily basis. I think the family is the key. If you have strong family support, I can tell you universally that patients are going to do just much better. And it's always great to see a spouse come in with a patient or other family members come in and at the time of surgery to have that family support, because it's nice to have some shoulders to lean on when not only you're in pain but dealing with the emotions of having breast cancer, but also just trying to navigate what the next day is going to be like. I think it behooves patients to do their homework. Not only do their homework about the procedures they want, but about their doctors as well. I mean, there's a lot of choices, and just because your friend used Dr. X doesn't mean that that's going to be the specific doctor that's going to be right for you. I think it's sometimes very helpful to talk to somebody who's been through it, because I can tell them all day what their recovery is going to be like, but having never been through it, I just know what I've observed and seen from my own patients. That's really valuable information that is really hard for me to share with the patient, and I think coming from the words of somebody who's been through it, I think it's received a lot better.